Everyone knows that straight teeth give you a beautiful smile. Did you know that straighter teeth can also affect your overall health? Crooked or misaligned teeth, also known as malocclusion, affects 74% of American adults. Left untreated, crooked teeth can lead to periodontal disease and create abnormal amounts of stress on teeth and jaws, which can lead to premature wear. The effects of crooked teeth can worsen over time and may adversely affect your overall health. Common types of misalignment include crowding, spacing, deep bite, open bite, cross bite, edge-to-edge bite, and excessive overjet. Crooked teeth can affect your bite, creating unnatural stress and pressure, leading to premature wear. Teeth that are subject to excessive pressure can develop chipping and notches at the gum line. Over time, the excessive force may also cause flattened or worn down teeth, or chipping and fractures at the edges of teeth. Additionally, a bad bite may produce improper forces on the jaw joint that may lead to pain in the jaw, earache, and even headaches. Premature wear can lead to gum recession, poor bone support at the roots, loose teeth, and eventually tooth loss. Teeth that fit together correctly last longer and are likely to need less costly dentistry in the future. Crooked teeth can affect your periodontal health because it's difficult to remove plaque and bacteria from the crowded areas. Bacteria that is not properly removed will multiply and trigger periodontal disease, which begins as gum inflammation, redness, and bleeding while brushing and flossing. If left untreated, over time, gum inflammation will progress to chronic infection, soft tissue damage, receding gums, periodontal pockets, bone loss, and eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages. Crooked teeth that are left untreated can trap bacteria that damage gum tissue cells and invade blood vessels. This can cause damage to cells that line your coronary arteries, increasing your risk for heart disease, stroke, and other illness. Correctly positioning your teeth for proper alignment and function will help prevent future dental problems and make a significant difference toward a healthy mouth and keeping your teeth for life. Ask your doctor and hygienist today about Invisalign, a series of clear aligners that are custom-made to gradually move and align your teeth. And start on the road to a healthier you today. Visit Invisalign.com to find a provider near you.
Hello, gentlemen. When it comes to women, when they see a guy, they look at his clothes, they look at his accessories, and his teeth. If you're not into shape, you can always get into shape. That's no problem. But you must take care of your teeth because bone loss is permanent.
For millions of adult Americans, periodontitis is a progressive and chronic disease. The disease begins with an unhealthy balance of bacteria that colonize within dental biofilm. The most prominent periodontal pathogens are P. gingivalis, T. denticola, and T. forsythia, collectively known as red complex bacteria. Research suggests some periodontal pathogens may corrupt the normal immune response, helping harmful bacteria survive and multiply, and the infection to persist and even worsen. Left untreated, a periodontal infection can contribute to increasing pocket depth. SRP alone may not achieve and sustain a healthier balance of bacteria. It may be difficult to access deep-seated bacteria with a scaler, and harmful bacteria left behind tend to recolonize quickly, potentially returning to baseline levels within a few days. When indicated, recommend a comprehensive treatment plan that includes both SRP and a locally administered antibiotic, or LAA, like Arestin, for the treatment of adult periodontitis. Clinical studies have shown that administering Arestin achieves greater pocket depth reduction than SRP alone. Arestin works differently than other LAAs with its microsphere delivery system. Arestin provides sustained-release minocycline, a broad-spectrum antibiotic that targets infection. Arestin starts as a fine powder, making it easy to deposit at the base of periodontal pockets. Once inserted, contact with gingival crevicular fluid begins to hydrolyze the microspheres so they immediately bioadhere. As hydrolyzation continues, water-filled channels form inside the microspheres. The minocycline inside gradually dissolves and diffuses through these channels into the surrounding tissues to achieve and maintain a therapeutic level of minocycline well above what's required to kill periodontal pathogens, and can remain active in the periodontal pocket for up to 14 days. Over time, the microspheres will completely bioresorb, leaving behind a healthier balance of bacteria and a greater reduction in pocket depth than with SRP alone.
Today on the Dr. Oz Show.
We're back with leading dentist and oral health expert, Dr. Jonathan Levine, and we're about to show you two groundbreaking oral cancer screening tests that you need to know about. Terry's here to help. She volunteered her mouth very bravely. Thank you.
You're welcome.
You go to the dentist often?
I do.
Does it strike fear into your heart when you do see the dentist?
It depends on what they're doing.
It does, doesn't it?
It sure does.
Have you ever had a dentist, in your opinion, examine your mouth for cancer?
No, because you only get 15 minutes there.
All right.
When you make your appointment, you have a 15-minute appointment. So I would say no.
So I want to change that across America today. So the first oral cancer screening test is something we're going to talk about called the Velscope. But before you show me the Velscope, can you just show us what an exam looks like fundamentally?
Okay. So our normal examination, we really want to look at all of the soft tissues in the mouth. So I'm going to put my loupes on. Please put your head back a little bit. Open for me. Open me. And what we're looking at the lips. We're looking at the oral and buccal mucosa. Open real big. We're looking at the cheeks. We're looking at the oral pharyngeal area, the tonsil area, all the way in the back, right? And now stick out your tongue. And the traditional ways we use this gauze as a tongue lasso, we go right around the tongue, and we're able to see the sides of the tongue, underneath the tongue, towards the floor of the mouth, left, right, and we'll say ah, and we're looking for any unusual red or white spots, any dark spots in the mouth.
Now, that lasso you saw Dr. Levine put in, that's your telltale sign that someone's examining you. They don't need any newfangled technology. It's not expensive. It just takes a minute. You just saw the exam. So even if you've got 15 minutes, if you get the one extra minute, the 16th minute, it could save your life.
Absolutely.
Okay, talking about the Velscope. We've got two technologies that are changing dramatically how we can quickly screen and identify cancers. This thing is really cool.
So the Velscope is a new technology, and it's a visualization tool, and it allows us to see the normal tissue and compare it if there's any abnormal cells. And it will highlight these abnormal cells early when it's dysplastic changes. What that means is when the cells are just changing from healthy to unhealthy.
You just
so
the glasses,
let's get your glasses on. Oh yeah, we're going to protect those baby blue eyes.
Elton John.
Okay.
Yes,
there you go.
Yes, she does.
All right. Come put your head back for me. Open for me. And we're going to look through. It's a narrow blue light.
I'm just going to put this on there so everyone can see as well.
A narrow blue light with special filters, and you see the green. The kind of apple green color, that means health. But when the cells start changing a little bit...
And let me show you an example of what happens when they do change. Here's the picture that we would have gotten normally. This is a normal eye view. It's just, tooth is here, and, you don't see anything too abnormal here. But notice this area looks a little bit indented. Look what happens in the Velscope. Instead of the normal green, you have that darkened area. So you all see that? Yeah. So it's very helpful to aid the eye in identifying that as not being normal.
Exactly. And when you see that dark area, when the clinician or the hygienist sees that dark area, now we know that we have some tissue that are dysplastic or even precancerous or even worse, and we know we have to take action.
Now, if there is abnormal tissue, there's a second groundbreaking test. And I love this again because I hate the idea of a doctor having to take a knife and scrape stuff that's not really bad in your mouth. And so this is a brush technique. If you don't mind explaining, it's called the oral CDX brush test. If you could demonstrate it, I think everyone should have this also. The back of your mind is a quick way of making sure you don't have anything going on.
This is a breakthrough that has hit dentistry. It's the oral CDX brush test with the laboratory testing after it. Basically, it's the equivalent of a pap smear for cervical cancer, and it allows us in the dental profession to painlessly test any cells that have been highlighted by our Velscope, or looking in the mouth and we're seeing any red and white lesions. And
you all see this
these
brush?
little bristles will rub up against these cells, pick up on the brush, and then the clinician then puts that on the slide and sends it out to the laboratory.
Can you all see that brush? Yeah. All right. Can you show how we would use it?
Yes. Okay. Please put your head back a little bit. Open for me. Now stick your tongue out, and let's make believe there is a lesion on the side of the tongue. And all we're doing is placing the bristles into it with a little twisting action. And now the cells are up on these little bristles, and this is then placed on a slide.
Did that hurt, by the way?
No, not at all.
Okay, good.
Quick and easy.
It's placed here on the slide. We then fix it, put it back into the plastic case, and off to the laboratory, where they have highly developed microbiological testing data to figure things out.
Very good.
Let's talk about pap smears for a second. Pap smears have changed the face of a cancer that used to be the #1 killer of women, of all the cancers. Think about that. It went from being the leading cause of cancer death in America to now cervical cancer is number 14, I think, on the list. So if you can take a cancer that was striking the fear into the hearts of women across the country for good reason and basically take it off the radar screen as a cause of death, now I think we've got an opportunity to copy that here.
I believe so, too.
Right. And I want everybody watching today to make sure that their dentist gives them the oral exam that we just demonstrated with Dr. Levine. In fact, I want you to demand it. You've got to be your biggest advocate. So that's the first tip to preventing oral cancer. Dr. Levine, take me through the rest of them.
Well, then limit your alcohol. Really limit your alcohol for sure. Avoid tobacco. Avoid UV rays. If you're using lip balm, make sure there's a high SPF in it. Make sure of that. And, of course, practice smart sex.
So can I extrapolate?
Safe sex.
Yes. The alcohol, 1 drink a day, which we talk about as being beneficial to your health. If you're getting more than 2 drinks a day, it tends to increase the risks of these cancers and other ailments as well. Cigarettes completely out of any kind, in fact, tobacco out of any kind. But let's talk about safe sex. Now, I've beaten around the bush on this a little bit. Let me be very clear. What I'm talking about is a dramatic change in how we have sex in America. What I'm trying to say is that to practice safe sex means that your partner has to wear a condom completely throughout the period of being together with them, or you've got to abstain from oral sex. Am I crystal clear on this? Yeah. Anything left to the imagination? No, we're all understanding this.
No,
all right?
I'm way on board with it.
You're on board.
Yep.
Right. From the moment you're together, it's got to happen, or you got to abstain from oral sex. Otherwise, we will have HPV transmission more and more into the mouth, and it's going to cause more of these oral cancers that we spoke about today. Thank you so much for letting us experiment in your mouth.
One question. Every 6 months should you have that? Because you goes every 6 months to the dentist.
To be safe, every single time you go to the dental office, your hygienist or your dentist is going to be performing an oral cancer screening examination.
Okay.
To be safe. But if you're going to the dentist only once a year, it has to happen at least once a year, especially today in our young population.
Okay. Very good. Fair enough. Yep.
Dr. Levine, thank you very much.
My pleasure.
To all my guests. We'll be right back, everybody.